Welcome, everyone. We are joined today by Lilley of BC Emergency Health Services. Welcome, Neil.
Hi, good morning, welcome. So I'm just going to share my screen. I've got a presentation to show, if that's okay, Candice.
Yes, absolutely. Thank you.
Okay. Oh, sorry. Okay, so yeah, good morning. My name's Neil Lilley and I'm the Chief Operating Officer for BC Emergency Health Services. And I'm here today to give you a quick presentation on what's called the Lifeguard app, which we implemented here in British Columbia to help with the ongoing overdose crisis. So just a little bit of an agenda for you today. Just going to tell you a little bit about the story of Lifeguard and how it came to fruition and how us in BCHS sort of took that idea and put it into fruition. And then a little bit on the overview of the application and the program and some of the statistics which we've had to date. And then obviously opened it up to some questions following that. So the story. So back in 2016, as you know, the overdose crisis got declared as a public health emergency here in British Columbia. And myself, I originally came from the UK and then via New Zealand into Canada. And when I arrived, the number of overdoses we were seeing in British Columbia were actually at an incredible rate, and something which I'd never experienced myself before in all my history of some 20 years working in emergency services. And it was really apparent to us that the amount of people which were also overdosing whilst alone. Interesting statistic here in British Columbia that over 95% of the overdoses which we respond to via 911, paramedics are actually able to reverse that overdose and save that individual's life. Unfortunately, it's those people which overdose that are alone for whatever reason, whether it be the stigma associated with it, or whether it's where they live in rural remote communities, and when they really do need the help and somebody to respond to them, unfortunately they're not in a position to place that call to 911. And we hear about it sometimes hours, days after the event, and unfortunately they're just another statistic on the BC Coroner's report that we see of those that are unfortunately passed away as a result of an overdose. So late in 2016, I got approached, 2017, got approached by a company called Lifeguard. Lifeguard was started and founded by a gentleman from British Columbia in Vancouver, who was currently going through treatment himself for addictions, and had actually lost his business and his family and was in a treatment center and become quite close to another resident of the facility. And unfortunately, whilst in recovery, that individual decided to use drugs again, and this time on his own, as nobody wanted to know about it. And unfortunately, he passed away from a fentanyl overdose, which, as you can imagine, as it does for everybody who loses somebody very close to them, it hit Jeff quite hard. And he came up with the idea of the Lifeguard app and really looking to use technology in a way that could help 911 services or paramedics respond to people that have overdosed. And that's where he came up with the idea of the Lifeguard app and brought it to us in BCHS. Instantly, I could see a natural fit, as I said, from what we were seeing already in British Columbia, really how we could potentially use a piece of technology to help place that 911 call if somebody had become unresponsive, unconscious, cardiac arrest, respiratory arrest, whatever the situation may be, if BCHS could then get notified of that call quite urgently. So what we did, we entered into an agreement to look at taking the application through some significant beta testing and some trials in some single residency occupancies in British Columbia. And we did that over a 2-year period to ensure that the system was safe and that we had user and people with lived and living experience continuously giving us feedback on the application and how it works and how we can improve it prior to launching it into the community. Now, as you know, British Columbia has done a large number of different initiatives over the years to try and combat the overdose crisis, from safe injection sites, take-home naloxone kits, and the Lifeguard app really was just another tool in the toolkit for trying to prevent overdoses. Unfortunately, when the COVID pandemic hit at the beginning of 2020, a lot of those measures which we put in place here in British Columbia started to get taken away from us. And what I mean by that, the safe injection sites in particular, with the restrictions that have been put on us and social distancing and self-isolation, etc., then a lot more people unfortunately started using alone in their own homes. And as a consequence, the overdose deaths started to rise quite rapidly again. So working with the Ministry of Mental Health and Addictions, the health authorities, BC Emergency Health Services, we decided at that point to look at the Lifeguard application, which had some significant data and positive data associated with it, to launch the app across the province in hope that people would use a sort of virtual overdose prevention site, I suppose you could call it that way. And we launched it in May 2020 that year, and it's been running across the province ever since. And I'm going to show you a little bit about how it's developed over time. So one of the main functions as soon as you log into our application is you hit a landing page, which is this main page here. As you'll see, it's around connections to services. There's a guide to help anyone to administer naloxone, and also how to give somebody CPR instructions. There's an opportunity to place an emergency call to 911, or also 811, which we have here in British Columbia, which is more in terms of medical advice from nurses and also physicians, through to the suicide prevention line and the crisis line, which do differ around the province and for specific groups of individuals as well. And then we have the services near me, which I'll take you into a little bit more detail in a second. And then we have the Lifeguard timer button at the top. And this is the one which really was the main concept of the initial application when we launched it, and was the only function within the application. But since we've been building it out and continuously evolving the product to help more individuals. So what happens on the use alone timer? If an individual decides that they're going to use the drugs alone, they're able to open the application and hit the timer. The first thing which they're going to be asked is to choose their drug of choice of which they're about to ingest. Now, there's a huge list of different drugs on there, from opioids, cocaine, marijuana, benzos. The user will select the type of drug and then hit the start button. Then what the application does is, using GPS coordinates, will pick up their exact location, just as if you were using any other app that you may have on your phone to place an order or a delivery to your home. What it's also going to do is ask you for additional information to help first responders better locate you in an emergency. So, for example, I might put the third floor, men's bathroom, last cubicle. And interestingly, a lot of the alerts which we get through the Lifeguard app, the descriptions that people actually input into you are quite detailed, and we are able to locate them quite rapidly. Once you hit the confirm button, the timer is then going to start. And it's a 1-minute timer initially, just due to fentanyl and carfentanil being such a fast-acting drug and can send somebody into a state of unconsciousness very rapidly. We want to ensure that minutes, even seconds, count in an emergency response if somebody does unfortunately go unconscious. So what happens is, towards the end of the minute, the phone is going to start checking in with the individual, and the alarms will gradually sound with a check-in point for the user to deactivate it should they be okay. If they are okay, they can hit extend, which will give them some more time to be monitored by the application. If they're unable to hit the activate extend button for any reason, once the 1-minute timer comes to an end, it'll come onto the last screen. And at that point, the alarms are sounding on the phone at full volume. Even if the phone is on silent, the application overrides all internal settings of the phone. The light will flash, and for a further 10 seconds, it will give the user the opportunity to deactivate the alarm and check in. If at that point the user is unable to deactivate the alarm, it's at this section here is when the emergency services are then contacted via a text to voice. So what happens is we fully integrated the application into our 911 system within EMS services, which bypasses what we call a primary service answer point, which usually direct you to police, fire, or ambulance. We have directly connected the application in, and when that call is placed, all the information which was then input on the phone, so the user's name, the type of drugs they've used, their exact location, the additional description, all the information is then sent through to one of my 911 call takers, who takes that information, enters it into the system, and dispatches paramedics to the scene immediately. What we also do is give a call back to that individual, just to check in to make sure it wasn't a false alarm and whether we need to continue paramedics. If they do answer the call at that point, then we can guide them to some alternative care should they want to be connected anywhere else, or should there be anything else more appropriate. And if there's not a response to the activation or the phone call back, then we continue paramedics to scene, which will then hopefully reverse that overdose for that individual. So one of the other features which I'm just going to show you was the services near me, which was on the front page. So this services near me looks at connecting users to services on a more local basis rather than on a higher geographical, such as the crisis line, the suicide prevention line. So what it does, it asks you for a drop-down list, and we can pick, for example, naloxone, drug testing, needle exchange, sober insights, anything which we want to. Click on here, and then it's going to populate all the different services which I've chosen in the proximity of where I am currently based on the cell phone I'm using. And it's able to give me directions, hours of operation, phone numbers to contact them on a real granular basis to help connect that individual to the most appropriate service. One of the other things we are able to do also is to send in to any user which is using the phone targeted push notifications to provide information to them. One of the main functions that we do use this for is to alert people of any bad drugs in the area. So if we know that a drug that has been tested, for example, in the downtown Vancouver area, we're able to then send out a notification to everybody within a specific geographical radius of that location, exact information on the drugs, even a photo of the drugs, and to advise them to sort of take caution when they are using for whatever reason, whether it's being tested for fentanyl or benzos or in addition, then we're able to provide that information to users on a very timely basis, which would have been quite difficult previously. So in total, since we've launched the application, we've now saved 44 lives. And what I mean by that is the paramedics have responded to scene, provided life-saving functions and managed to reverse the overdose. Some occasions the individuals have gone to hospital for further monitoring, but there have been some which chose to remain at home, but 0 lives were lost and 44 were saved by paramedics that responded. So a little bit of overview, what else we do. So we work with the Lifeguard digital health team to provide not only enhancements to the application and to provide data reports, but they also provide community support in marketing materials, which we roll out to the communities, and they're all customized dependent on the specific needs, whether it be for an Indigenous community, whether it be for a youth community. And then we work with them to design all the materials and provide a portal on their website, which we're able to log into and download and provide that information. One of the other pieces of work that Lifeguard have also done is with the Metis Nation. I've worked very closely with them to do some customization of the application and change the theme within there to make it more culturally appropriate and safe for the users, and also to change some of the settings then within that theme, which is going to guide individuals to different services which are more appropriate to their community, such as the crisis line, for example, would be the Metis crisis line. We're also able to provide different resources through the application, and also different languages as well. So to date, since it's launched to the general public, we've got over 7,500 users, approaching 85,000 sessions. As you can see, there's been 112 EMS calls and 25 overdose reversals. The 44 number, which I showed previously, was in terms of all the trials as well. So in total, 44. Just on the live version, it's been 25 to date. And there's been 81 callbacks to scene when they've chose not to contact us for the ambulance. The 6 false alarms were generally from users which had downloaded the application and trying it to see what would happen. And again, we called back and there was no need for an ambulance, but no overdose had occurred and no use of drugs had occurred. So that's pretty much everything I wanted to share with you to date in terms of what the ability with the application and some of the statistics, and just thought I would open it up to some questions. So whilst we're waiting to see if there's any more questions coming in, I should tell you that we are currently looking to make further enhancements to the application, and we're currently in some beta testing behind the scenes with a new version of the application, hoping to roll out by the end of March. And our main focus is really changing and building upon the app to make it more around connections and looking at renaming it to the Lifeguard Connect app. One of the main features that we are going to change within there is to create a peer-to-peer network within the application, which will use AI and algorithms in the back end to make and suggest connections to individuals, whatever the reason that they use in the application. So one example could be from parents which have unfortunately lost somebody through overdose, are able to connect to similar parents which may have gone through that tragedy also, and talk to them about their challenges and get support on a peer-to-peer level. Or it could be just, I'll take me for an example, a 40-year-old white male working in emergency services who could be struggling with PTSD and also substance use problems. Then I could use the application to connect with somebody else who was going through a similar situation from anywhere around, who was using the application to have that peer-to-peer connection. And it would be a virtual anonymous connection where I'm able then to share some of my challenges and difficulties and have support on a peer-to-peer level. I should also add as well, just one final piece. A lot of people ask us in terms of the data which is collected and how is that stored, and does that cause any issues or barriers with people downloading the app? So the Lifeguard app doesn't track any user information in what idea in any way. The only information that we ever know which comes from the application is when that 911 call is placed, and that is sent directly to 911 services, and it's not gathered by Lifeguard in any way. They collect very high level information in terms of the whereabouts city of an app, how often it's used, but no personal identifiable information is ever used in any way from the application. So I see a question here. Any idea what percentage use in this app? I'm not sure the percentage which you're referencing. If you're wondering around the percentage of drug users which are using the application, I'd say it's a very difficult number to quantify, purely because the denominator would be very difficult to achieve. I think one of the main reasons why we find the Lifeguard app so successful and useful is because it's able to target what I like to call the hidden population. It's all those people which we are unaware of that they use drugs. We don't know where they are. We don't know how often they use drugs. But what we now have is a virtual anonymous connection to individuals which use the app, which we never had that connection to before. And then we're able to share information and also understand a little bit more in terms of some of the drug usage is happening. In terms of connecting to people in rural remote communities, no, we haven't had any barriers at the moment. As you know, northern BC is quite sparsely populated, and actually some of the biggest take-up of the application from a BC perspective has been in the rural and remote communities, just due to the barriers in accessing care into some of these places in comparison to if you lived in downtown Vancouver. What we are able to do is not only does it pick up the GPS location, as I said, and the address, but it also sends through the exact GPS coordinates to 911 services, and then we're able to locate them quite easily. So some people do question about how is the 911 response sufficient in those areas. Well, we are able, and we do simultaneous alert into first responders in the area, and that could be through a specific group which you identify which work in a rural and remote community, at the same time as connecting through to 911 for an ambulance to respond as well. Not having a cell phone, of course, yeah, it is a bit of a barrier if people don't have smartphones. There's 2 points to this. I would say the application isn't a sort of one solution for all, and we fully understand that, and there are some other ways in people which can connect through, such as the NORS virtual phone line. Not as much use, I think, on that compared to the application, but it is another option. But we have worked quite closely with some phone providers, especially Spark here in BC, who have donated quite a substantial amount of smartphones to different communities to ensure that people can access the application, and it's fully loaded onto the phones when they provide them to them as well.
Thank you, everyone, for those questions. If we don't have any other questions today, I just want to remind you that you do have the opportunity to come back and ask questions in the feedback form if something comes to mind later. But otherwise, I want to thank you so much, Neil, for joining us today, and thank you for your time.
No problem at all. Thank you for having me, Candice.